Welcome, everyone. Welcome to day 2 of National Nursing Week here at NNPBC. I want to thank you all for taking the time to join today. It's going to be a fun session to share about a new program that we've launched at NNPBC and how this is kind of impacting primary care nursing across the province. So sit back, relax, and we hope you enjoy. Before we get into things, I do want to acknowledge that I am joining this virtual space from the traditional, ancestral, and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. I'd like to also acknowledge that NNPBC serves and supports nurses and nurse practitioners working across the full breadth of what is colonially known as British Columbia. British Columbia is home to over 202 First Nations, Inuit, and Métis communities, and we stand in these relationships with humility and respect. I am so proud to be able to say that at NNPBC, we remain committed to anti-racism, social justice, and equity in all that we do. And I'm able to say those words with so much truth and humility behind them and excitement, really. And it's woven into really all the pieces of work that we do. Hello, everyone. I am Sammy Sakon. I am the manager of the Nursing Network for the Nursing Initiatives and Primary Care Program. And I'm going to be joined at this webinar today with Carly Crocker.
Hi, everyone. I'm Carly, and I'm a registered nurse in beautiful British Columbia. I'm one of the nurse consultants for the Nursing Initiatives for Primary Care Program. Welcome, and we're happy to have you join us.
Thanks, Carly. We also have Mariana on the call here. Mariana is program analyst for the team, and she's going to be monitoring the chat, monitoring the Q&A, and also providing some supplementary documents and links throughout the presentation. And we also have amazing Andrea in the background, making sure everything's working seamlessly. So thank you to this amazing team that was able to put everything together. As you are joining this space, we also want to make sure that you are oriented and aware of everything that you can do. So first things first, we cannot see the participants joining. So get comfortable, grab your lunch, really get comfortable and enjoy this session. So there's no fear in us being able to see you. There is a chat function available in Zoom, so we are going to be disabling that once we really get into the meat of the conversation, just because it'll make it easier for Carly and I to focus on what we need to do. But there are reactions and emojis that we would love for you to send throughout. We want to know what you're liking, how you're reacting to things, so keep the emojis coming throughout. The Q&A function is something that we are going to use later in the session. So we are going to have dedicated time for Q&A. We want to hear all the questions that you have to offer. We hope that we can answer all of them, but if not, we can always take things away and have the conversations offline. And finally, there is closed captions for those who want that additional layer of accessibility throughout the session. Although we cannot see you, we do want to keep this session as interactive as possible. So we are going to be using Mentimeter to do that. And so we'll get into that now. For those who haven't used Menti, it's just a fun interactive tool you can either use on your phone or on your desktop browser. Oops. So what I would like everyone to do, grab your phone and just scan the QR code on the screen. Or alternatively, you can open up a browser window, go to menti.com and enter that 8-digit code. And I'm already seeing some people in there. Once you're in there, just hit that heart emoji so I know you're there. Oh, we got lots of hearts, lots of love. Perfect. Oops. Okay, so actually I'll go back one more. I just want to make sure everyone gets in there. Okay. So I have shared where I'm joining from, but I would love to know where you all on the call are also joining from. So here we have a Menti activity where if you just take your finger, there should be a little black dot on the screen, and you can click and drag it to wherever you are joining from in the province. We have a really cool map here from the First Peoples map of BC, and it shows the traditional or the colonial area of British Columbia, but there's an overlay of Indigenous languages that were spoken across BC here. So as you're placing where you're joining from, you can also see First Nations languages that were spoken in BC, and approximately 50% of First Nations languages in Canada were actually spoken within BC. So that was a really cool learning for me. Okay, we have an amazing spread across the province as well. A little concentration in the Lower Mainland, little Okanagan. Nice. I love that. Okay, so we know where you're joining from. Now we want to know a little bit about who you are. And my screen is going to go black, but we are back. So what is your professional background? Obviously, we will have a lot of nurses on the call, but what type of nurse are you? Are you an allied health professional? Are you just an ally to the nurses? We just love to know what your background is. Okay, the RN team is going strong here. Very cool. We got some others as well. Certified RN, I forgot about that one. Thank you, Jennifer. Awesome. Clinical nurse specialist, another huge role in the nursing team. Awesome. Okay, I'm really glad we were able to get to know each other a little bit more. So what exactly are we here to talk about today? Today, Carly and I are going to talk a little bit about the reality of primary care in BC. A lot of the stuff you have likely heard before, but we're going to summarize it and kind of share from our perspective what we're looking at and what we think the problem is. Next, we're going to talk about integrating RNs and LPNs into primary care and into team-based settings. And then after that, we'll do a deep dive into our program, the Nursing Initiatives for Primary Care program, and start to understand how our program is helping that integration of RNs and LPNs into primary care. We'll touch a little bit about how nurses who are interested can get involved in these primary care roles. And then, as I said earlier, we'll have a lot of time for question and answer at the end. Okay, well, without further ado, I'm going to pass it over to Carly to kick things off.
Thanks, Sammy. All right, so we've got a quick poll for you all, if you still have your phones available. How many people do you think are currently without a primary care provider in BC as of early 2025? You can go ahead and select your option there. I'll give you a moment. Okay, we got some answers still trickling in. Nice. Thanks for doing
Pretty
that.
smart group, I would say, Carly.
Yeah, so so if you guessed around 700,000, you're right. That's the estimated number of British Columbians still without access to a primary care provider, which is a clear sign of how significant and ongoing this issue is. So the reality is primary care in BC is under real strain. Our aging population has more complex health needs, which means providers need more time. They need more resources per patient. At the same time, we're having fewer family doctors that are available. So many are out there, they're cutting back their hours, they're retiring without a replacement clinician to take over for them, or some of them are leaving family practice altogether. As a result, we have more people turning to walk-in clinics and emergency rooms for non-urgent care, which is adding pressure to an already stretched system. And right now, there are an estimated 300 to 400,000 people on wait lists alone, just hoping to be matched with a primary care provider in BC. The one possible solution to help address the primary care crisis in BC is to strengthen team-based care. And this means fully including RNs and LPNs in the process. Even though their training and their skills align closely with the goals of primary care, nurses are still largely underused in these settings across Canada. Nurse practitioners are already well integrated, but the rest of the nursing workforce hasn't been meaningfully brought into the picture. A big part of the problem here is a lack of understanding around what RNs and LPNs can actually do in a primary care setting, how their roles work in team-based care models, and the impact that they could have on patient outcomes and system capacity. So closing this gap could be a game changer for primary care. To understand the value RNs and LPNs can bring to primary care, it really helps to look at their core competencies. So that's what they're trained to do, their roles and responsibilities, and their scope of practice. When RNs and LPNs are integrated properly into care teams, nurses can contribute across a wide range of areas. So from doing health assessments, managing care plans, providing education, promoting wellness, and helping to prevent illness before it actually starts. Their expertise spans many settings: maternity, pediatrics, chronic disease management, even infectious disease, which makes nurses incredibly versatile and valuable in a primary care environment. Okay, so let's look at a real world example to see how team-based care, specifically involving nursing, can make a difference. Here we have pictured on the right there, Dale. He's a 54-year-old man who was recently diagnosed with type 2 diabetes. His hemoglobin A1C came back at 8.7% after routine blood work. He works full-time in construction. He has a family history of diabetes, and he's been feeling more fatigued than usual with occasional blurred vision. He's overweight, but otherwise he has no major health issues, and this is his first follow-up visit since his diagnosis. All right, so here on the left, you'll see we have a typical practitioner-led appointment, say with a family doctor or a nurse practitioner. There's usually, between 10 to 15 minutes available per patient. And in this time, the practitioner may check vital signs, review Dale's lab results and blood sugar logs. They may go over medications, make any necessary changes, possibly a referral to endocrinology. It's not that education or deeper conversations aren't important. They absolutely are. But the reality is there's just often not enough time. The next patient might already be waiting, and long appointment backlogs make it tough to go much deeper in a single visit. So let's compare this to the scenario on the right. Here we have a nurse-led appointment lasting 30 to 45 minutes. The nurse would not only check Dale's vitals, weight, and blood sugars, but can also walk through his labs in detail, consult the practitioner if needed, and can spend some time on medication education, including how to teach self-injection if needed. They'd assess for symptoms, do a foot and eye exam to catch any early complications, provide coaching on diet, exercise, and lifestyle, focusing on how Dale can take control and slow progression of his disease. There's also time to answer questions, making sure that Dale really understands what's happening. When patients understand what's happening with their health, they're better equipped to manage it and make the necessary changes to improve. So what does this example show us? It shows us that team-based diabetes care works. It leads to better health outcomes, fewer complications, and a more efficient use of healthcare resources in BC. It's a proven patient-centered approach that empowers individuals with diabetes to live healthier lives. Okay, so Sammy, we know that team-based care with nurses improves outcomes. What is the holdup?
That's a great question, Carly. And I think we asked that question over and over and over again until the ministry heard. So in 2023, the Ministry of Health actually announced an expansion of the nursing role within primary care networks. And that would be mainly through this Nurse in Practice program. So I know many of you on the call likely have heard of nurses working in practice already. However, the bulk of these have typically been health authority nurses. Through this new program, the Ministry of Health is providing direct funding to private clinics or patient medical homes so that these clinics can hire RNs and LPNs as direct employees into the clinic. So we think this is great, it's the first step in getting nurses involved in team-based care. But there's just one thing missing still, and that's what our team defines as the invisible infrastructure gap. You picture a nurse in a health authority setting, and you think about all the supports that they have around them. They have their professional practice, there's the HR, there's the union, there's honestly just the team environment that they get to interact with on a day-to-day environment. But when you take a nurse out of this setting and they may be the only one in a private clinic, they tend to lose all of that. And sometimes the family physician who may or may not operate the clinic or the clinic manager might not be able to provide that support to the same degree that was done in the health authority setting. And so that's exactly what our program is looking to close. The Nursing Initiatives for Primary Care program is looking to close that invisible infrastructure gap. So our team is planning on doing this and has already launched a bunch of initiatives across these seven dimensions. First, considering orientation. Orientation is often, and I'm sure all of you have had good orientations and not so great orientations, but it's the best determinant of how you feel in a team, your likelihood of retention, and your ability to really excel beyond your role. We really want to work with clinics to build out a fulsome orientation and onboarding for nurses so that they know exactly what to do. And so the clinics also know what to do when they're hiring a nurse. Next, looking at integration, we want to make sure once the nurse is brought in, they're able to integrate well into whatever team exists in that clinic. There could be other nurses, LPNs, RNs, physicians, nurse practitioners, even the MOA. We really want to make sure that this is a seamless integration for that nurse into the clinic setting. For mentoring and coaching, and Carly will touch on this a little bit further, we have a dedicated team of practice success consultants who are available to provide one-on-one customized support to each nurse who is hired through the program. Next, with role and scope optimization, and I am not a nurse by background, so this has been a huge learning for me in the process. But what I've learned is that the nursing role is so broad, and nurses are capable of so much in any clinic in a hospital setting. But the definitions of what you're able to do are often blurred and unclear, especially to other healthcare providers. So our team is going to be working diligently on really defining the role of nurses in primary care settings and enabling them to optimize their scope. Next, with team-based care, this is something that we do believe is a solution to the existing challenges with primary care. So we're going to be doing a lot to educate not only our nurses, but also the other clinicians in the clinic on what effective team-based care looks like and how each clinic can achieve that once they're hiring a nurse. Quality improvement initiatives are a huge asset that nurses bring to clinic settings. So our team will be supporting the nurses in learning how to build out a robust quality improvement initiative from beginning to end, track deliverables, evaluate on outcomes, and really find ways to enhance not only their role, but the clinic's operations. And finally, touching on peer connection, we've also piloted an online community for primary care nurses to join, where they can find that peer connection with other primary care nurses across the province and be able to share learning, share knowledge, access resources and courses, things that they wouldn't normally be able to do if they step away from the health authority. I just want to throw a friendly reminder, if you do have any questions, we'd love for you to throw it in the Q&A, and we will be answering those at the end. So that's an overview of what our program seeks to accomplish over the next few years. This is how we are actually set up. So we have two work streams, one being the Practice Success Program, and the second being the Collaboratorium. So I'll pass it over to Carly to talk a little bit about Practice Success.
Awesome. Thanks, Sammy. So through the NNPBC program, nurse consultants support primary care nurses by providing coaching, mentorship, and guidance. They help build clinical skills, share resources, strengthen team-based care roles, and support quality improvement. Recently, we've had some nurses contact us with questions around encounter coding. So specifically, how to document in-person versus phone visits versus joint visits with a GP or an NP. We guided them through the Ministry of Health's coding process, provided step-by-step support, and ensured that they felt confident to reach out to us again. We also took that information and we shared it with the ministry, who in turn informed us that they're committed to and working on improving clarity in a new documentation guideline for nurses in primary care.
talking on mute. Paired with the Practice Success program, we are also launching, or we have launched the NIPC Collaboratorium. And what the Collaboratorium is an amazing online community for primary care nurses in BC to connect with each other, share their stories, ask questions, find resources, and learn from different types of courses. Our practice consultants are also available on the Collaboratorium, so it's amazing if you're just stuck on something in the middle of the day and you want to send them a quick DM, you're able to do that and find that you have that support network, even if you are the only nurse in a clinic. I also want to be really clear that the Collaboratorium is not a space where our team is directing information to you. It's a community where the nurse's voice is really going to be elevated and heard. We want to hear from the nurses in practice. We want to understand what your problems are, what your challenges are, and how you want to solve them. And ultimately, we want to work with you to find the best solutions to how you can integrate and succeed in a clinic environment. So our program launched, I would say, in October. So it's been about 6 to 7 months, and we've moved from the establish activate phase into now the grow phase. So October to January, we were really looking at hiring our team, getting our goals and objectives in place, and setting up that foundational governance structure. But now we've been able to pilot the key initiatives. We have the practice success team hired. The Collaboratorium is live with 10 amazing nurses joined. And as we go, we're collecting feedback from those nurses and continuously iterating on what we're delivering in our program. As we go, we are hoping to grow and expand participation with the Nursing Initiatives and Primary Care program. So we have heard a lot from health authority nurses and primary care nurses working in other environments that they would also be very interested in accessing these supports. And what we're saying to that is we love to hear it. It's not forever, but for right now, what we are doing is piloting our program specific to the nurses on these nurse and practice contracts. But if you are a nurse and you're not on a nurse and practice contract and you are interested in engaging and learning more with our program, I'm going to ask Mariana to just put our email address in the chat. Please reach out to us. We want to hear from you and we want to see how we can support you. So back over to Carly now to share a little bit about what nurses who participate in our program will gain.
Great, thanks, Sammy. So what are the benefits of participating in the NIPC program? The NIPC program is all about supporting the nurse's success in primary care. So the nurse involved will get access to tailored guidance, curated resources, regular learning opportunities, and a network of experienced nurses to learn from and collaborate with. It's a chance to build confidence, grow professionally, and work at the top of their scope as part of a strong patient-centered team. How can nurses get involved in the nurse in practice program? So for nurses that are interested in joining, we suggest keeping an eye on job opportunities through the Division of Family Practice website. They can check Health Match BC. As well, you're welcome to reach out to our team at the email provided. Mariana can throw it back in the chat again. And if we know of anything, we're happy to connect you and stay in contact. It's also important to ensure that licensing and registration is active with the college. And if possible, gaining any experience in primary care settings will always be an asset. We'll also share an information page on the nurse in practice contract in the chat for more details. All right, so access to primary care in BC is a big challenge, but we're committed to being part of the solution. With nearly 700,000 people currently without a primary care provider, the need for change is clear. By focusing on team-based care that fully integrates nurses, RNs, and LPNs, we're not just increasing access, we're improving the quality and continuity of care for everyone. Our goal is to build a health system that better supports everyone who relies on it. Thanks for joining us today.
Thank you, everyone. And now I will open the floor up for some Q&A. So preferred if you use the Q&A function. I think if you click the 3 dots, it should appear if it's not already on your toolbar. But you're able to ask questions anonymously, upvote other questions that have been answered if you really want to hear about those. But yeah, let's get into it. So Carrie, I see your question around why are RPNs not included in this model. That's a great question. So as of right now, it has just been the province's intention to start with RNs and LPNs, but they've clearly said that RPNs likely in a future iteration will be included. So if you are interested in chatting more about that, if you are an RPN, we'd love to hear from you. So reach out to our team, NIPC team, at nnpbc.ca or com. Com is in the chat. Okay. We had another question around if there's a master's level program that would help RNs who want to get to the next level in primary care to do so. So I'll start by answering this, and Carly might have more details, but there actually is a very new program out of UBC Okanagan specific to primary care nursing. I'm not sure if it's like an official certification, but it provides you with training, learning, education on specifically primary care nursing. Carly, does that cover it, or is there anything else you want to add?
Yeah, I'll just add that I'm not sure the answer to this question, but if you email us at the NIPC email, my team might have a lot more information on this, and we're happy to circle back with you and see what's available. So please don't be shy. Email us. We love to hear from everyone out there.
Mhm. Same with is there a section for nurses who work in virtual primary care? Not as of right now, but we do want to hear from you if you are doing that, because we'd love to understand more about how you are doing this and in what ways you're working with British Columbians. So whoever asked that question, please reach out. Curious if you have a website with clinical practice guidelines for primary care nurses. These would help with role clarity and both us and other professionals understanding what our role is and what we can do in clinical practice.
Danny,
Carly, you want
I
to
can
take this
maybe
one?
take it from this one. So we have recognized that this is a huge gap, maybe one of the biggest gaps for the nurses that are out there working in primary care. And this is a priority for us. So we did bring someone on that works in professional practice to see what we can help with in this area, because we're not the employer. So we'd have to work kind of in conjunction with the clinics or the employers for the nurses. But I'm, as a nurse myself, guidelines are important. They're crucial for nursing success and for building confidence and scope. So this is a priority for our team. It doesn't exist yet, but we are working on trying to connect with the clinics and empower the nurses to help create policies and guidelines where they're missing, and bring those into practice. So no, it doesn't exist yet, but we're very well aware that this is a need.
Next question was around the nurses that work as the coaches. Are they nurse practitioners or RNs with expertise? So I'll do you one better on that, Clara. They are RNs and LPNs with experience in education, in acute settings, and in primary care settings as well. So we're very fortunate with this team that everyone brings their own unique skill set, and we're really just joining forces to support each nurse the best way possible. Carly, anything else you want to add on that?
Yeah, so right now there's 4 of us, of the consultants. All 4 of us have at least over 10 years experience. I believe Sonia has 20. Personally, my background is emergency nursing and primary care. So everyone has a little bit of a different experience, but it's all relevant, and we're all nurses. So that was really important when building out the team, is if we're going to be coaching and mentoring and guiding nurses, that it's by nurses.
Is there support education resources for nurses who are currently working in primary care already? Yes, so we know that there might be different ways that you're working in primary care. You could be a health authority nurse, you could be employed by a CHC as well, you could be employed directly by a clinic, but not currently on that nurse in practice contract. So to whoever asked this question, I encourage you to reach out, because there could be for you. And honestly, we are looking to support all nurses who are in this space as best as we can. So we'd love to hear your situation a little bit more and see if we can help.
Also, I would just encourage whoever wrote that question just to email us as well, because I also recently heard about a primary care a primary care boot camp. It's like an online refresher course for primary care nurses. Off the top of my head, I can't remember exactly what it's called, but if you email us, we can connect you with that as well.
And then Carly, do you want to take the next one around, can new grad RNs get involved / apply for
Absolutely.
nurse and practice roles? Yeah.
Yeah, so what the nurse would need to do is to connect with the clinic that is doing the hiring. Sometimes they list, requirement of, 1 to 2 years experience preferred, but as a nurse myself, we know there's a shortage out there. Often that can be waived. Sometimes it's not even required. So definitely don't let being a new grad deter you. Um, if you find the opportunity to apply through one of the clinics that are hiring, do so, and we're happy to support you too. We are tailoring our program not just to new nurses, but to both new, experienced, in the middle, everything. We want to be useful all over for the whole realm of nursing careers.
And the next one, how do you solve the problem of nursing scope of practice being dictated by fee for billing? Carly.
So I can't answer this. I will say
Okay.
that, but I will say that it's been raised, the concern with the billing module, if a physician's getting paid to take a phone call and the nurse does that, do they still make, the same money for that? That's why the province is introducing the new way for general practitioners to be compensated for their time, to hopefully change from this model to the new one. It's not my area of expertise, but I do know that our manager, Carly, knows a lot about this. Again, I don't want to sound like a broken record, but email us and we can definitely provide you more information on that.
Yeah. And again, it goes back to like, this is a two-way program. We are learning from the nurses who are in this space and the challenges that you are facing. So if this is something that you want to talk further about, we're all ears and we're open to listening and understanding what we can do. This one's got 4 likes. Are any of these supports available to primary care nurses working elsewhere / not hired through the nurse in practice program? So working elsewhere, I do think there is a fine line with that. I think you do have to be within British Columbia to access this program. We are the British Columbia Association. The funding is through the British Columbia Ministry of Health, but not hired through the nurse in practice program. As of right now, we are focused on those that are hired through the nurse in practice program, but what we're hoping is that we can expand our reach. We're in conversations with health authorities. We're in conversations with community health centers. We want to understand if the primary care supports in these settings are equivalent or if they can be further bolstered by what we're doing. So we're hoping that we can connect in and expand our reach to other nurses. But reach out to us because, there's so many different situations. We don't know what your specific situation is. So we'd love to see if we can bring you in and get you the support that you want and need. We had Ashley throw in the UBC Okanagan Micro Certificate Program. So yes, that is the program that UBCO has for primary care nursing. Thanks, Ashley. Okay, we have a question around, is there a bridging program for LPN to RN in BC? Carly, would you know the answer to that, or do you have more information on that?
We do have 2 LPNs on our team that are going to know a lot more about that than I do. I believe there is a bridging program, but I also know that I know that more LPNs are looking to get into it and it's not widely available, is my understanding. So again, reach out and I will have one of the LPN members on our team get back to you and go into that in more detail.
Thanks, Carly. Providers have been reportedly trying to use nurses more as MOAs. How will NNPBC support nurses in these scenarios? Thank you for that question. And yes, we are very aware that whether it be due to the limited understanding of the nursing scope of practice or just the need to have an MOA, this has been happening in some clinic settings. And our team are going to be very, very strong advocates for nurses to practice nursing and nothing beyond and into the MOA space. We are doing this right now. We are doing this by creating firm relationships with the doctors of BC, with the divisions of family practice, and when possible, the actual clinic managers. And we are trying to get connected with the clinics before they even bring the nurse on board. So we can give them a heads up on, hey, this is what the nurse role could look like in your clinic. This is what it should not look like, so that they're prepared in advance. But in the situations where we can't get there in advance, we'll be there when we are aware of the nurse in the clinic. And so again, onboarding and orientation, integration, team-based care, all things that we are really going to work to not only educate the nurse on, but the entire clinic team on, in conjunction with the divisions and Doctors of BC, to make sure this does not happen. Okay. Hello, I'm an Indigenous professional practice consultant with FNHA. I would love to learn from the consultants on this team about how we can get better support in primary care nurses. Amazing. Thank you, Vanessa. I think we have been in touch with some FNHA people as well. I don't know what team, but amazing. Please get in touch with us. We love to share learning and knowledge.
It looks like she has reached out, but maybe hasn't heard back. So Vanessa, I'm just
Okay.
gonna put your name down here and I will follow up on that, okay? Thank you for messaging that. I'm sorry if someone hasn't got back to you yet.
And the next question on, are all of the FNHA primary healthcare initiative health centers involved in this mentoring program? Not to my knowledge right now, but I know we are in conversation with FNHA staff and team members. So possibly in the future, but please reach out to us, because this is an area that we really want to advance and grow into and support. Are you able to share any of your FAQs from primary care nurses at this time?
Sure, yeah.
Yeah, we
I
got a
can take that
few.
one.
Yeah, that's an easy one.
Yeah, off the top of my head, I'm just trying to think, okay, so the main things we've been seeing lately since starting, we are a new program, but we're hearing some issues around encounter coding, some like they need some clarity around that. So we've connected with the ministry to create a clearer document, which hasn't been made yet, but they are working on it. And we're circling back quite often to get that and work with the nurses through that. We've also heard again about the guidelines that some nurses would like, particularly around ear syringing. That's been a big one because it's quite a common practice in the clinics. What else have we been doing? Frequently asked questions from nurses. Quite a few. That's off the top of my head here, but I actually am starting an FAQ document to keep track of what the nurses are sharing with us, so I can bring it back to the team and we can address those needs first.
Yeah. Just want to confirm this service is for now, not for primary care nurses that work within health authority funding. Correct, for now. But again, if you want to learn more, if you want to get in touch, we are not closing that door. We want to hear from you, and we want to understand what the needs from the health authority perspective might be. Oh, thank you, Amy. Amy sent an email there for questions about the bridging program. Will this video and questions be available after the session? Yes, the recording will be available after the session, and Andrea, our administrator here, will send out an email with the links to the recordings and all the recordings from the week. Okay. So those are all the questions from the Q&A, but I do see some in the chat that we can get to. Can we get a link to the collaboratorium? Our nurse in practice primary care nurses don't have access to it. Yes, for sure, Louise. Please email the team after and we can get in touch. And I can send you the link. Are there a number of seats set aside for Indigenous nurses? So actually, I don't know from the ministry level if that's something that they're tracking. Within our program, so we are working with the nurses who are on these nurse in practice contracts. So we are not allocating any seats. It's everyone who's on this contract should engage and gets to engage with the program. But from the ministry level, that's actually a great question. We do have regular touch points with the ministry, and Pamela, I think that'd be something that we would love to take up to them to see if they are tracking, and if not, it should be a great thing that they bring on their radar. Sonia, okay, thank you. So how do we work with the health authorities? We have a community of practice support team for interior health, and I see you have your own support team as well. Thanks, Allison. So yeah, as of right now, we don't overlap and work with the health authority nurses, but we recognize that to truly enact systems change, we need to have good working relationships with the health authorities, with divisions, with PCNs. And so we are working with health authorities in a way that we're sharing knowledge, we're sharing learning, we're understanding how to build the best program that integrates within our current system and is able to move things forward. So I'd say that's how we're currently doing things. In the future, things might grow and advance, but we would love to hear from you and your practice support team. All right, Louise has one of the RNs working on scope documents, scope and development as well. Yes, Louise, please reach out to our team. I feel like we're gonna have a nice long chat. So a lot of learning and a lot of information to share. I love it. Okay. So that is the end of the questions. Thank you so much, everyone. Very thoughtful questions. Julie, are you looking to connect with educators to ensure they are meeting the needs of primary care nurses? That's a great question too. Carly, would you say Shannon is kind of functioning in the role of an educator right now? You'll have better understanding of this.
Yeah, so we did hire onto our team recently a clinical nurse educator who's been in primary care for 16 years, I believe. Shannon, I'm sorry if you're here and I'm getting that wrong, something like that. But so right now she's our go-to connection for that. But always we're looking to hear from nurses out in the field, especially educators, because you're going to know what the nurses out there are really needing and what they really want to learn. So absolutely send us an email. If you connect with our team, we can even connect you to one of the consultants in your region as well. So it doesn't just have to be the broad email. You can start connecting with me. For example, I'm the consultant for Fraser in Vancouver, but we have one for Interior, the Island, North, etc. So definitely connect. We'd love to hear from you.
Yeah, and I said earlier, we're wanting to grow our program. The primary care nursing doesn't just end with the nurse being in the clinic. Julie, what you're saying about the educators and all of the supports around it, the schools that bring the nurses into primary care, it's all a system, and we need to make sure that we're well integrated and have those connections across the system to make sure that information is flowing from end to end and that everyone's on the same page so that we can really make a difference and impact primary care. Okay. Thank you so much, everyone. I'm very serious when I say reach out to our team. We are so eager to learn more. There's so many people that have been working so long in this space already, and we need to honor the knowledge that you've built and that you've shared across the province. And so we are just another piece of the puzzle to try to make things better. And yeah, thank you so much for attending today.
Thanks for all your questions.
Right. Have a great Tuesday and hope to see you at tomorrow's webinar as well.